That's the recording started, Chair.
And that's the live stream started, Chair.
Thank you. Good morning and welcome to the Banff and Buchan Area Committee on Tuesday, the 18th of August 2026. Please note that the public section of the meeting is being recorded and published online for public viewing after the meeting. If possible, could members activate their cameras to enable you to join by video, and could all attendees mute their microphones when not speaking? Please do not come in during items unless I invite you to do so. If members wish to speak on any point, raise your hands in the Teams meeting, or if you have dialed into the meeting, you can raise your hand by pressing *5. If any member loses connection or has a technical issue during the meeting, please alert the committee officer by a separate instant message, or if possible, email her. James Allen is on hand today and will provide remote IT support. Before going into the business of the meeting today, I would, on behalf of the committee, like to extend our congratulations to a resident of the Banff and Buchan area who has been recognised in the 2026 King's Birthday Honours. Craig Thomas Trail of Fraserburgh has been awarded the British Empire Medal, the BEM, in recognition of his services to the community in Fraserburgh. Mr. Trail serves as chairman of the St Haven and Patuli Harbour Trust. His honour is a fitting acknowledgement of his commitment and contribution to the local community. I'll now ask the committee officer to take the sediment. Emma, please.
Thank you, Chair. I can confirm we have apologies this morning from Councillor James Adams. Can I ask if the following councillors are in attendance today? Councillor Stuart Adams.
Present.
Councillor Bell.
Present.
Councillor Cox.
Present.
Councillor Finlater.
I'm here, present.
Councillor Sutherland.
Present.
Councillor Mayer.
Present.
Councillor Maynard.
Good morning, present.
Councillor Reynolds.
Present.
And Councillor Cassie's having some IT problems just now, Chair, and he's trying to join us as soon as possible. So I can confirm that we should have 9 councillors in attendance when Councillor Cassie returns. I can also confirm that the following officers will be in attendance today: Angela Keith, Area Manager; Morag Stevenson, Senior Solicitor; Abdullah Sadiq, Shaney Solicitor; Shona Campbell, Strategy and Transformation Manager; Fiona Stephen, Location Manager; Ryan McGregor, Mental Health and Learning Disability Manager; Julia Matthew, Quality Improvement Manager; Pamela Singer, Team Leader, Property and Facilities; Raymond Terrace, Project Manager, Property and Facilities; John White, Asset Disposal Surveyor; Andy Moyer, Principal Asset Management Officer; and myself, Emma Nichol, Area Committee Officer.
Thank you, Emma. The first item on today's agenda is the declaration of members' interest. Members, please state if you have an interest to declare, and if you have, please clarify the item number, the nature of the declaration, and whether or not you will leave the meeting. Councillor Cox.
Thank you, Chair. A transparency statement in regard to items 8 and 9. Its report is for noting, so it's transparency that my connection with Banff Castle Community Association is declared in these reports. So it's transparency, no voting to be taken, but happy to be guided by the monitoring officer. Thank you.
Thank you. And Councillor Sutherland.
Good morning, Chair. Transparency statement also. Item 9, I wrote a supporting letter for AOG Cairnbulg, so application, and Fraserburgh Community Church also have a family member involved in the application. However, this matter has been dealt with under delegation, therefore I will remain and take part. Thank you.
Thank you, Councillor Sutherland. The next item on today's agenda is the resolution on equalities, item 2A. In making decisions on the attached reports, members are reminded of their legal duty under Section 149 of the Equality Act 2010 to have due regard to the need to eliminate discrimination, harassment and victimisation, advance equality of opportunity between those who share a protected characteristic and persons who do not share it, and foster good relations between those who share a protected characteristic and persons who do not share it. The protected characteristics under the legislation are age, disability, gender reassignment, pregnancy and maternity, race, religion or belief, sex, sexual orientation, and marriage and civil partnership. If you do not agree with the resolution on equalities, please open your microphone and say so. I'm just noting that Councillor Casey has joined the meeting. Good morning, Councillor Casey. Just to check, do you have any declarations of interest this morning?
No, I don't. Thank you.
Thank you. Item number 2B is exempt information. Do you agree to take items 11, 12 and 13 in private? Please open your microphones and state if you agree.
Agreed.
Agreed.
Thank you. Item number 3 is the minute of the meeting of the 16th of June 2026. The minutes are for approval as a correct record only. If you do not agree them as a correct record, please open your microphone and say so. Item number 4 is the list of outstanding business at the 18th of August 2026. Angela, do you have any updates on the list of outstanding business, please?
Good morning, Chair. Good morning, Area Committee. The outstanding business list is as set out before you. You will note for items 2 and 3, we've got new dates of the 29th of September. For those items coming back to committee, that's due to the change in the Area Committee meeting cycles. We brought it forward a few weeks. The items of information are filtering through on a number of areas, particularly from environment and infrastructure services, but we'll carry them over because I'm conscious that you haven't received all the updates, but we are recommending dismissal of items 4, 5 and 7, Chair.
Thank you, members. Councillor Reynolds.
Thank you very much, Chair. Morning, everyone, and thank you, Angela, for that. I have a concern about removing items 4 and 5 as set out in this paper, number 4 regarding street lighting columns, and number 5, the landscape services work programme. The briefing note, for example, I won't go into the details because it's not appropriate here, but I note that the briefing note with regard to street lighting, along with item number 5, raises a number of questions that we should put before officers in a public domain. The briefing note on the street lighting columns has been circulated to us on the 7th of July, actually, and it was headed internal only elected members. I'm assuming that doesn't prevent it. I mean, it shouldn't be confidential and should be in the public domain. We asked for a briefing note that has been provided, for which I'm grateful, but it should be in the public domain because the street lighting issue is of huge significance to many of our communities, not least the isolated communities. So what I'm asking is that they remain, both of these remain on the as set out, but also that we have a session with officers where we can ask questions regarding the briefing notes that have been supplied. In the street lighting issue, one of the points that's raised in the paper is that there are now 17,000 street lighting columns which are reaching their end of life, as it were. And, you know, this is a big concern. And it's caused a lot of anger and frustration, it has to be said, in terms of our local communities. So there should be an opportunity on the back of the briefing note regarding street lightings for us to ask officers questions quite soon in light of the response that we've had. The same applies to item 5, which is the landscape services work programme. Again, this is a considerable concern. Very grateful for the information that has been circulated to us with regard to the situation involving participation of local community groups. But again, the information that we have provided doesn't really detail a lot of the process surrounding the option of utilising local community groups and local community businesses that have insurance, etc., etc. So again, I think this should remain on the table, as it were, and that there should be a session with officers so that we can ask questions of officers with regarding the information that's been provided, because both of these issues, street lighting and the landscape work programme, are ongoing concerns, and they need to be dealt with quickly. And communities are frustrated. Community councillors are raising concerns, and there should be that opportunity. These are live issues. That's essentially what I'm saying. Very live issues of great concern. Thank you.
Chair, if I could come back.
Yes.
Thank you, Councillor Reynolds. Valid points that you raise in relation to the street lighting elements. And we were, there was clarification from the service that they were preparing a front-facing document that would be available to the communities. So what you had was in advance of that. And I think they were gathering more information. What I unfortunately don't have is an exact time scale for when that would be made available. But we did have the reassurance from the service that there would be an update that was publicly available. But we can certainly retain that item and come back with clarification on when information will be available. In relation to the landscape services aspect, we are actively working with area teams across the whole of Aberdeenshire with the landscape services department to look at a framework or a way in which we can actively work with community groups. That's not at a formal developed stage as yet. It's very place-based. It's very focused around the capacity that we've got across all of our community groups. But there's certainly a willingness from the service and the area teams to work with community groups to explore where they can maintain, enhance areas within all our communities across the Banff and Buchan area. As I say, it's not a formal document or a formal way of working. It's very intuitive as to what the community's needs are. I don't know if that offers you any more reassurance, Councillor Reynolds, but we can certainly arrange an informal session with the service to look at the work that's actively happening across the Banff and Buchan area.
Thank you. Sorry, Chair. No, thanks for that, Angela. I'm very happy with the information that you've suggested there. I'm just concerned that to remove them from the table, as it were, at the moment, not least in light of what you've said and the further work that's surrounding both of these very important issues, is probably not appropriate. It's something that we need to really address as we move forward. So I would ask that they remain on the table, as it were, in terms of the paper. Thanks.
Thank you, Councillor Reynolds. Councillor Cox.
Yeah, thank you. It's particular to item 5. There were questions asked when we had the presentation in regard to budgets, and the officers indicated that there was high pressure in the Banff area due to the demands placed at cemeteries, etc. And when the question was asked in terms of that budget, we weren't provided that information. In terms of community support, thank you, Angela, for updating us. But this goes back several years when the suggestion was community empowerment. It goes right back to those days. I appreciate that you don't have the direct management of landscape services. However, we keep talking about empowering and supporting the communities. We need to see something more concrete than just the message that's coming from landscape services. Where is this response to the community groups? Also, are they aware of all the community groups that could take up the challenge, and what are the opportunities around that to develop even more? We've got a fantastic new team in the Banff and Macduff area, training days, but they need resources as much as anybody else if they're carrying out the work. So I would agree with Councillor Reynolds that we need further information on the landscaping how we're empowering it, and when's it going to be done, because we're talking a good number of years since council took the decision to support community groups. But also would like the detail on the budget, because that wasn't provided. If there's areas, and it shouldn't be one budget for every area because they're all different, but where there's more urban development, there's more pressure on ensuring our streets are clean, sprayed and maintained, and there seems to be a disparity throughout Aberdeenshire, whether there's more active community groups or not, but there's definitely visible evidence of different landscape maintenance being carried out through Aberdeenshire. So if we can get that added to the report in terms of the budget lines, is it divided six ways, or is a recognition of additional pressures on the landscape service? Thank you.
You're on mute, Chair.
Sorry, Angela, do you want to come back on that?
Yeah, unfortunately, I'm not in a position to clarify any of that information today, Chair, so I'm happy to take it away and look at an informal session with the elected members just to consider the work that's being done. I know the service are committed to a more formalised fill your boots approach, where they are actively working with the communities to understand how collaboratively we can work together, but I'm afraid I'm not able to fulfil Councillor Cox's wishes today, but certainly happy to take it away and come back with some more information.
Yeah,
Thank you,
thank
Angela.
you, thank you, Chair.
Sorry.
I appreciate what I said, that it is a service led, but it isn't just community groups. For example, the local golf courses want to maintain their ground but are not permitted to do so because the council stops them doing it. So it isn't just community groups, it is other organisations that improve the amenity of our towns and villages. Thank you.
Thank you. I would also add, Angela, that I think a sort of strategic plan between landscape services, community groups and community payback. We were at Invercargill Community Council last night and we were asked, what community payback did. I think having a yearly plan rather than people, just making requests, I think that would be helpful. Councillor Sutherland.
Yes, thank you, Chair. It was just to follow on from yourself, both community councillors, Cairnbog, Invercargill and Rathan, MC and Cortes, were all asking the same questions about landscape, about what they can do, and obviously if briefings are confidential and to councillors, we can't share what's in them, but all I could assure them is that there would be something coming out to them. And they were quite keen to let me know that they would like a working together situation rather than a heap of rules that stops them doing what they want to do. So they were both kind of vocal that way. So I said that there was a mind to work together with the community, and that the officers were doing their best to get something to them as soon as they could. So clearly I think it should stay on, just in light of that. Thank you very much.
Thank you, Councillor Sutherland. Therefore, I think the committee are agreeing that we keep items 4 and 5 on the outstanding list. However, we will dismiss item 7.
Yep, Chair, that's my understanding also, and we'll move forward with informal sessions to explore the work that's being done with both roads around street lighting and landscape services with our collaborative work with community groups.
Thank you. The next item on today's agenda is item number 5, which is the Scottish Fire and Rescue Service Banff and Buchan Area Committee Performance Report for Q1, 1st April to 30th June 2026. We have Richard Trott, our station commander, in attendance. Good morning, Richard. If you'd like to introduce the item, please.
Good morning, Chair. Good morning, everybody. So the scrutiny report for the first quarter of 26-27. Just a brief overview of how we've been getting on in the area. Excuse me. Overall, incident numbers have been fairly static, but as with every report I've done so far, a different set of incidents have kind of cropped up with our the largest numbers. On the whole, outdoor fires have gone up, which unfortunately the time of year it is kind of a normal progression of the year. Other incidents have come down, so bit of good news regarding fire fatalities have actually reduced to 0 through that quarter, which is a nice progression in that regard. So excuse me a second. Wonderful, will my notes disappear? So a quick look at casualty numbers, what we've had this last quarter. Excuse me again. So accidental fire fatalities and casualties, as I said before, dropped down to 0. The number of casualties and fatalities we've had where we've worked with other agencies, partner agencies, is still high, but it has come down. So we're on that. Sorry, I've just seen a hand go up.
It's all right, Richard. We'll wait until you've presented the report. But
perfect.
As we've said before, please don't feel you have to go through the whole report.
No, that's fine. I'll skip through this bit. Road traffic collisions. Again, we've been down. I know the interest is always on the E947. We have had one incident on there, but ages-wise, it's not young people for a change. So although our target has been, as I discussed in the last meeting, our target has been youth, young adults, trying to reduce the number of RTCs. Hopefully that seems to have been taken on board, but whether that continues, we'll see over the next quarter. Deliberate fires have gone up. As I said before, this kind of coincides with the high number of wildfires that we've had, or outdoor grassland fires. A lot of it centered around the Rosehearty area. I know we discussed it in the previous meeting, but the figures have only come out in this quarter. So a lot of those numbers is because we just kept going back and forth to the same incident due to multiple calls to the system. On the back of that, we went round a number of the schools to give talks and presentations, along with my understanding is we gave advice at some of the breakfast clubs as well to try and reduce the number of incidents where people haven't got anything else to do other than set light to the hillside. Also on that, we've had our first Crash Live event at Banff Academy, which was attended well. The feedback we had from those the students that were in attendance seemed to all be fairly positive. that it would change the way they drive and the way they think about being a passenger in a vehicle as well. We've continued with further breakfast clubs. Banff and Buchan was successful again, and we'll look to continue those moving forwards, as well as the ones in Fraserburgh. I think that is probably everything in a very brief nutshell.
Thank you, Richard. Just before I bring Councillor Reynolds in, the Crash Live event, are you going to roll it out to Fraserburgh?
It's certainly something that I can discuss with Fraserburgh. I can't see a reason why we can't do that. Sorry, I'm just making notes so I don't forget. Yeah, I'd certainly bring that up with the station and see if that's something we can push.
Thank you. I'm sure our head teacher at Fraserburgh Academy, Mr. Bolton, will appreciate that. And I'm glad that you went round the schools. Perhaps that maybe helped, hopefully, a wee bit. Councillor Reynolds.
Thanks, Chair, and thank you very much, Richard, for that presentation. And it goes without saying, thanks very much for everything that you and the team are doing and have been doing over the summer months. I wanted to raise something now, Richard, which I don't know if you can deal with now, but get back to us if that's the best way to approach it, because I want to ask a question about the concern around wildfires. Obviously, over the summer, we've seen the situation with the Cairngorms, and prior to that, prior to our recess, we had the major gorse fire in Cairnhill Road in Rosehearty. But I think that it would be true to say that over a period of reflection now, and I'm looking at some of the information that's coming out of the Fire Brigade Union, for example, there is a concern that the situation with regard to wildfires is not going to go away anytime soon. And we are particularly vulnerable because of the coastal situation and the unpredictability of North Sea winds, gorse blazes, wind-driven beach and lynx fires, and seasonal volatility. And you made a comment there, Richard, about people setting fire to things, and I know that there is an increasing concern. I'm not suggesting that it applies specifically to our area. Maybe it does, I don't know, but it's around arson, actually. A lot of representatives of the fire brigade out with our local area have publicly spoken out that arson is increasingly a concern, and it's not a subject area that we like to touch upon, but it is there, and we need to be conscious of it. But generally speaking, in terms of wildfires, Richard, I'm looking to see, and it's on the back of some of the Fire Brigade Union information and ask, and it's the collaborative action plans that are in place dealing with wildfires. Are you able to provide reassurance when there is a major incident, for example? Do you have the resources? Because across Scotland, there is a vacancy situation with regard, I think vacancies are, I've got the figure here, it's across Scotland, the on-call and retain system faces a 31% vacancy rate. And there are all sorts of knock-ons in relation to that. How are we locally in terms of vacancy rates? I don't think it's been a problem in the past, but maybe you could help. So collaborative action plans, are they in place specifically around wildfires, how you deal with that, and the resourcing of it, Richard, and vacancies, please? Thanks.
I'll start with the arguably the easiest bit first. So the vacancies, I'm not sure exactly of the percentage. Some stations are better resourced than others. Some Some of the stations have historically never had an issue resourcing. I'll use Fraserburgh as an example. They've traditionally held almost 100% staffing rate wherever possible. Some of our other stations have always struggled historically because of the size of the village that they are resourcing. So if we've got a station that can hold 12, 14 personnel, which would be their standard numbers, there may not be 14 people within that village that are capable of, or willing, one or the other, of going through the system, passing the processes, hitting the fitness and strength levels to be able to join, or alternatively, they're unable to meet the contractual hours that we require for our on-call commitments. So it's a two-edged sword. What I have got is I've been requesting the stations in the area to start having open evenings to invite people along, trying to ensure that we open the doors to as many people as possible. There's still a perception in the fire service or in the public that firefighters have got to be 6'2", broad-shouldered, be able to carry a person out of a burning building, whereas the reality is you've got 2 of you or 3 of you or 4 of you that will carry somebody out of a burning building. You know, it's trying to make sure that we get that message out to as many people as possible, try and get people through the doors so that we can then get as many people in as possible. There are issues on our side where trying to get people from the start point to the end, but that is in the process of being worked on so that we can speed that process up. But like I say, unfortunately, it's not just us that's stopping people coming in. It's also that image of the fire service. So we are trying to change that. Looking at joint working, we have a number of different work streams for all fires, not just wildfires. We have lists of specialist personnel that we can call upon, whether that is from remote locations for expert knowledge, or whether that's volunteer lists of people with 4x4s, wildfire capability, off-road vehicles, all that sort of equipment, and again, experience in those backgrounds. We also have the ability to draw across the whole of Scotland for those specialist resources. So I don't know, you may have seen in the newspapers, we were utilising appliances as far afield as Musselburgh to utilise their specialist resources to come up and help in the Cairngorm fire. And that was to try and move different appliances into different locations, making sure we've got that availability. When it comes to longer fires, as we have had with Cairngorm itself, that side of things, this incident will have a lot of learning points to come out from it. And, you know, we will take those on board. We'll work with partner agencies, we'll work with landowners, etc., to make sure that everything that is required to continue working with those individuals will be in place, so that we're not just fighting blind or turning up and hoping everybody else arrives. You know, those procedures have started and they are in place, but we just need to firm them up, make sure everything's exactly right. And as far as arson is concerned, we'll continue talking to kids, adults, etc., and trying to put that message out there that whilst it can be fun to, you know, have a little campfire and enjoy that side of things, it's also not acceptable to go around lighting fires. The damage it does, the time it wastes for us, and the resources that if we're here doing this, we're not able to help out at an RTC, road traffic collision, or house fire, etc. So that's definitely in hand as well.
Thank you very much for that, Richard. Thanks.
Welcome.
Thank you. And Councillor Menard.
Yes, good morning, Richard. Thank you for that presentation. Going back very quickly onto the wildfire side of things, how well equipped are we locally? You've given us a picture of the broader picture of what's gone on, but how equipped and well trained are we locally to deal with these things? Because, as you know, a small fire can get out of hand very quickly, but if you've got the right equipment and the right people in the right place at the right time, it can save an awful lot of hassle further down the line. Have you got the right equipment locally to deal with this sort of thing, or are we going to have to rely on people from Musselburgh to come up and do things, if you know where I'm coming from?
I do know where you're coming from. Obviously, we'd rather not have to rely on people coming from Musselburgh. That was an extreme case, and I hope that we're not in that position again. With the resources we have in the area, they are constantly being reviewed. At present, the service is deemed what we have at the required level. There are things that the service would like to do, but budget constraints are one of the major issues we have. Whilst the service would love to give out wildfire PPE, and that is something they are looking at. We're looking into new contracts for that particular PPE. We can't turn around and say, everybody will get this, because not everybody it's not necessary for everybody currently. What they have done is, I believe the last meeting, we were still putting in place what specialist resources we have, and putting the training in place. That is now in place. So there are more wildfire units, there's more specialist resources, better trained resources in the Aberdeenshire area as a whole. As far as the Banff and Buchan area, there's not been a huge change. We're still running with the same personnel, the same appliances, the same equipment, but the resources that are there are much closer. So before, we would have been looking outside of Aberdeenshire into Murray with Elgin. Now that we've got further appliances within the Aberdeenshire area, so the skill sets and the equipment have improved from the previous picture that I painted in our last meeting. I hope that answers the question.
Yep, spot on. Thank you.
Welcome.
Thank you. And Councillor Sutherland.
Thank you, Chair. Good morning, Richard. It's another topic I'd like to ask you about. The communities have seen a fair bit of youngsters going about in electric bikes and scooters recently. Have you come across a lot of RTCs involved with that? Or how is it from a fire position and rescue position? Have you seen that encroaching your work like the police have seen on a daily basis? Could you enlighten me on anything to do with that? Thanks.
So we've not seen an increase in our workload from them. We've been very lucky in that regard that they've either not been involved in road traffic collisions where they've been ridden in the wrong locations, and touch wood, it's not been a problem with batteries catching fire and that side of things. It is part of the information that we give out at home fire safety visits about how and where to charge these batteries, and also, trying to encourage people to buy official ones rather than aftermarket knock off batteries and chargers. So we're trying to kind of steer people down the right road with that. Thankfully, in our area, it's not been an issue for us, but we also support the police's stance on, they're not speed-wise, if they're unrestricted, that's breaking the law. There's other chances of things happening that they're not have a knock-on effect with us. So it is a side of, we'd encourage people not to use them, use them in the right locations at the right times.
Thank you for that. I was just concerned that maybe you were seeing more RTAs with them involved. So that's good news at the moment. Thank you very much.
Yeah, no problem.
Thank you. And Councillor Bell.
Thank you, Chair, and thank you, Richard. I had a family member who had an incident when he was burning weeds, and had the fire brigade arrive at his door. I was talking about it yesterday, but he was also he didn't realise that somebody had reported smoke, and he was quite surprised to find all these firemen in his back garden. But he was told that there's a number that you should call if you're going to be lighting fires. Could you tell us what that number is?
I can, give me 2 seconds and I'll pull it up.
I think it would be quite useful to know, so that we don't have the fire brigade arriving at our door if we're doing anything.
Yeah, it is something that we do encourage people to do. Let's go to there. So the number is our Dundee control room, which obviously covers the whole of the north. And the number is 0138283 5804.
Thank you very much, Richard, and I shall pass that on to anybody that I know.
Thank you.
I will be burning.
Yeah, with that, it is something we encourage anybody that's planning on having any sort of burn to call that number, because like I say, what will happen is control will go through a lot of information of whereabouts are you, what your address is, etc. They'll also go through things like do you have a hose pipe? Do you have a bucket of water? Do you have something that is accessible to put that fire out if it's starting to become larger than you had planned, along with any information regarding making sure somebody stays there with that fire at all times. But also what will happen is, if somebody does call in a fire in that location, they will phone whoever's having the burn and double check, is there anything else going on in around you, or is that smoke coming from yourself? And it just reduces our turnouts in that regard.
Thank you so much for that information, Richard. Very useful.
No problem.
Thank you. Angela, wish to come in?
Yeah, thank you, Chair. I would agree that is really important information. Richard, if there's something that the Fire and Rescue Service actively are doing to promote that number, certainly from an area team perspective, we would be happy to distribute that across our community councils to raise awareness. So certainly take an action to touch base with you, Richard, after the meeting and get that organised.
Certainly, I will touch base with my colleagues and see if there's an official document that we can then put out.
Yeah, that'd be helpful. Thank you, Chair.
Thank you, Angela. I was just about to suggest something like that. I don't see any further hands. A couple of things, Richard. The Crash Live event, it's maybe based on Councillor Sutherland's comment earlier, good to bring in a piece on electric bikes, because we have had an incident in Fraserburgh of a bike running into a car, and I've seen several incidents where they want to expand their horizons, but they are shortening their lives, some of them, by their actions. They are not aware of the consequences of high speed. So I think that'd be useful. I mean, this has been an extremely trying time for the fire service, especially with the Cairngorms and with the Rosarte fire. So I'd just like to take this opportunity to thank your teams all over Grampian for the work that they've done. it takes a lot, and especially for retained firefighters, giving up their, their time. So I'd like to thank you. I'd like to pass on my thanks to your staff, and we will see you the next time. And I would say stay safe.
Thank you very much for that. I'd also like to pass on my thanks to yourselves for your support over the last 6 months. I'm actually coming to the end of my term. I know you've had a high turnover of station commanders, and for that I can only apologise. Moving forward, there is somebody going substantially into my post, and it is Chris Henderson, Station Commander Chris Henderson, who I believe you had prior to myself. So hopefully it'll be a recognisable face. But he will be in post moving forwards, and that should be a permanent position. So you won't have another one of me pop up and go, oh, yeah, I'm here for 6 months. So with that, I'll pass on his details as well for these meetings moving forward. But like I say, thank you very much for your support over the last 6 months with myself.
Thank you, Richard, and good luck wherever you go next.
Thank you very much.
The next item on today's agenda is item number 6, which is the Aberdeenshire Health and Social Care Performance Report for Strategic Delivery, their Strategic Delivery Plan 25-26 to 2028-2029. And in attendance today, we have Shona Campbell, the Strategy and Transformation Manager, joined by Fiona Stephen, Location Manager, and Brian McGregor from the Mental Health and Learning Disability Manager. Good morning. Ms. Campbell, would you like to introduce the item, please?
Yes, thank you, Chair, and good morning, everyone. So Aberdeenshire Health and Social Care Partnership Strategic Plan for 2025 to 2035 was approved by the Integration Joint Board in December. The Strategic Delivery Plan sets out the key work streams commissioned by the Partnership Senior Leadership Team and approved by the IJB to support delivery of our 2 strategic priorities. And those are prevention and early intervention, so helping our communities to stay healthy and well for longer, and focusing our support on those with the greatest need in our communities. The performance report shared with you today was presented to the IJB on the 27th of May 2026, and it describes the progress made against 7 work streams which are currently of most strategic significance to the partnership, including a strategic review of our community hospitals, strategic review of care homes and very sheltered housing provision, Home First, adult carer strategy, the Learning Disability Day Service Review, Place Planning, and Strategic and Operational Service Planning Alignment. This is our first quarterly performance report relating to the new Strategic Delivery Plan and covers the final quarter of 2025-2026. Appendix 1B provides an overview of the key areas of progress, which includes completion of the first phase of the strategic review of community hospitals and starting work on phase 2, development of the adult carer strategy, and development of the Health and Social Care Partnerships Workforce Plan and Market Facilitation Plan. And the adult carer strategy delivery plan is included for your information at Appendix 1C. I would like to also draw your attention to some further key areas of progress in recent months, including the publication of the Partnership's annual performance report for 25-26, the delivery of agreed savings in 25-26, which has contributed to stabilising the Partnership's finances, and the approval by the IGB of the Workforce Plan and Market Facilitation Plan this year. Important to note that the Strategic Delivery Plan does not include the projects that are aligned to our medium-term finance strategy and that are included in the Partnership Savings Programme for 2026 and 27, and updates on progress against those projects are included in the Partnership's financial performance reporting. The Strategic Delivery Plan also doesn't include operational service performance or the continuous improvement activities which are routinely undertaken by our services. Work is in progress to strengthen our approach to performance measurement and reporting through aligning our strategic, operational and financial performance reports more closely, with an intention to implement a new style of reporting from November 2026. An update from the local team highlighting key areas of success and local challenges is included as Appendix 2 to the report, and my colleagues Fiona Stephen and Ryan McGregor are also in attendance with me today, and together we're happy to take any questions. Thank you.
Thank you. I have a few questions, and they are centred mostly about day services for our vulnerable adults. So at the last meeting, we did ask that a comprehensive list of the outcomes from the review of day services had come back to us, i.e., has every individual got a positive destination? Are they settled in that destination? And are the service happy that they are happy? I think we still await that. I have also concerns around third sector service providers. Now, it might be that this is actually a governmental issue, but I don't feel that there is enough scrutiny around the suitability of these services. There's one started up just lately in Fraserburgh. I think we have two levels of agreement of how we deal with these people, whether they are, you know, on a service level contract or not. But I really think that there needs to be a sort of inspectorate of these services to ensure that they are meeting suitable standards. Some of these folk are among some of the most vulnerable in our community, and we have to ensure that they are being properly looked after, and they are being they are having some fulfillment from the services that they are accessing. So if we could answer that first, please.
Yes, thank you. So I might bring Ryan in to answer your question around the day services, the learning disability day services review. If I might just answer your question around third sector service providers. So we work very closely with Aberdeenshire Voluntary Action as the third sector interface organisation for the Health and Social Care Partnership. So do meet regularly with them, and happy to pick up that question with them. I guess if the services are registered services that we commission directly from, then there would be contract monitoring around that and performance reporting around that. So I'm happy to pick that up with my commissioning colleagues. I don't think I'm able to answer fully today, but I'm happy to pick that up and come back with a response, Councillor Mayor. But if I might just bring Ryan in around the day services review.
Thank you. Ryan?
Yeah, thanks, Councillor Mayor. I suppose apologies in regards to the individual outputs. My understanding was that I certainly have briefed something, and it's maybe just sitting with Alex Piddy as the partnership manager, and obviously she's not here today. So I can pick that up with Alex to make sure that that's progressed. But certainly I have produced a briefing for that for yourselves that follows through the individuals and the kind of outputs, just was what you were making reference to there. So I'll make sure that that is picked up and actioned. And I do share your concern around other providers or people establishing kind of businesses there around that. We do have our training and skills framework, and we have recently opened that up and had some new providers successfully come on to that framework, and we probably aren't in a position to look at that again, although we may consider that further down the line, and that's some of the discussion that I had with our commissioning contracting team. If people do decide to establish their own business, then it's, I suppose, how people do that and how people kind of commission and work through that. So it's I suppose people's own choices to establish their own business and company, and then if people choose to then commission or choose to use those services, I suppose there's a little bit about them doing their own due diligence. I suppose when we do come on to commissioning ourselves, and then we do that bit of commissioning and due diligence there, and that's what the training and skills provider does or allows us to do, or that framework allows us to do. But I do know your concern that you know, these are some of our most vulnerable individuals that we have, and we need to ensure that there are right and appropriate supports for them to access that. So it is a concern and something we are monitoring, and I do note that the new provider that you had alerted me to the other day. Hopefully that kind of answers your questions.
Thank you, Ryan. Yeah, I do have concerns, so I would like some information back on the issues. Thank you. I'll bring in Councillor Cassie, please.
Yeah, thank you very much, Chair. I suppose I should declare an interest being a member of the Integration Joint Board, purely for transparency purposes. I welcome the report. However, the local element to this, Appendix 2, it's got some very nice words there, but there's nothing that we can measure. It says we are doing this and we're doing that. There is nothing that we can look at and say, yes, it is improving, or no, it is not improving. So we're not getting that element of scrutiny that we would require at a local level. For instance, we continue to closely monitor the demand associated with the Mental Health Care and Treatment Scotland Act, etc. So something that we can actually physically measure would be a lot more helpful than just a scripted piece of wording. I was going to ask the same question in relation to the day services, because it got off to a very bad start and then did improve with members getting, or some service users getting some different treatments as opposed to what was there in the first place. But it was more along those lines. I very much welcome the grip that has now been put onto the financial situation and moving the health and social care partnership to a more sustainable level, as opposed to where it was a couple of years ago. So it's more on the presentational side of things as opposed to the what we have before us. And just to reinforce the chair's points in relation to day services, has everybody got something now that they should have had when the policy was introduced in the first place? Thank you.
Thank you, Sharon.
Shall I come back in on that one? Yes, yeah. Thank you, Councillor Cassie. I think you're absolutely right. We can do a lot to improve the level of information that we're providing at a local level to enable the committee to scrutinise our performance a bit more clearly. So we have been working on the sort of operational performance framework for the partnership, as well as our strategic delivery plan reporting and indicators for our workforce plan as well. We've actually got a development session with the board on Monday, and that will be the part of the focus of that development session. Will be presenting the work that we've undertaken on the performance framework so far, and what we're looking to do is to align that to the partnerships revised leadership structure, so that when that new leadership structure is implemented, we'll have very clear reporting at a service level around performance that can be broken down to a local level. So absolutely take your point. You want to be able to see what that looks like. You want to be able to track that over time, and to hear what we're doing to improve where we need to improve and see what the outcome of that is. So absolutely agree, it needs to be improved, and something that we're working on at the moment.
Thank you.
Thank you. Councillor Reynolds.
Thank you very much, and thank you to Shona and Ryan for your comments and the presentation. I'm conscious that some of the colleagues around this table have got more comprehensive information than I have, but I'd like to ask a little bit of a scattergun question, as it were. But there were two prongs to my questions, Shona and Ryan. The first is in relation to the context is set out, as Councillor Cassie mentioned, in terms of Appendix 2 and the localised component. And I'm looking at sort of where we go from here, sort of thing, and the moving forward. And the first issue is around rural disadvantage and how you see this playing out in the short term going forward, not least because of the incredible demographic pressures that we face at the moment that we're all aware of. So in terms of basic service access, reliable patient transport, and healthcare delivery, how can you, what reassurances can you provide? Because these areas are becoming much more difficult and expensive in relation to that localized delivery. And I'm specifically concerned about that rural community, the isolated rural community perspective. Okay, so that's one part of my question. The other one relies on a lot of the feedback that's coming out of the trade unions with regard to workforce. Where are we in relation to, and how do you see us going forward with relation to staff shortages and vacancies and our reliance on temporary workers, which are obviously expensive? How do we see that playing out at the moment with the mounting degree of stress for all of the above that we know exists at the moment and is going to be an ever increasing challenge, not least because of the demographic. So the staffing issue really, and vacancies and key areas of concern with regard to that. Thank you.
Okay, thank you, Councillor Reynolds. So in regards to maintaining and improving access to services and addressing rural inequalities, I mean, the partnership does have an objective to ensure that we don't do anything that increases that inequality. We want to ensure that people have equal access to services as far as we reasonably can. And that is more challenging, obviously, across a rural area where we have to balance being able to deliver a service in the most efficient and effective way, with also ensuring that it's accessible to people regardless of where they live in the area. And we can't possibly offer every service in every local community, but we can do what we can to make sure it's as accessible to people as it possibly can be. So taking account of transport infrastructure, etc. We do work very closely with the Think service around transport to healthcare appointments, and we use that service to support people to either link in with a statutory provision or with voluntary service provision as well to support them in accessing healthcare appointments. And we have had a really interesting project locally where our services worked to understand why people were having difficulty attending for appointments, and then looked at the scheduling around the availability of public transport, etc., to enable people to attend to attend those appointments and not miss appointments. So I mean, it is a priority for us to ensure that we address inequalities where we possibly can. Is there anything else you'd like me to say around that, or shall I move on to the second part of your question?
Well, I'm really grateful for what you said, and that's very interesting. It is the sort of going forward aspect, and you've addressed parts of that. I guess there's an overarching concern and an interest that I have in where does what you've just said there show now? Where is the overlap in terms of engagement and the work that you do with regard to the place-based approach of the council? Where's the interaction there with regard to that?
Yeah, so our local teams would certainly be involved. If I start, I suppose, at a strategic level, we have representation at the community planning partnership executive group. So we're linking in with community planning partners at that level around place planning. But our local teams are also involved with the area teams around place planning locally. So our public health improvement team colleagues are around the table, as well as representatives from our local services. So very much part of that place planning process. And you'll be aware that the Health and Social Care Partnership, we have a statutory responsibility to develop locality plans. We've chosen not to do that separately from our community planning partners, but to undertake that as part of the development of place plans for Aberdeenshire. So very much linked in, and I guess it's around how, you know, we have our strategic objectives, but supporting communities to live well, to live healthily is not just the responsibility of the Health and Social Care Partnership. So I guess what we're trying to do is get further upstream in terms of prevention and early intervention, through working very closely with our local communities and our community planning partners. Yeah.
Thank you.
Thank
And
you.
the second
workforce
bit,
part, yes, yeah. So, you know, workforce planning it's definitely a challenge for us in the partnership. Our workforce, we are not expecting our workforce to grow significantly over the next few years, because we you know, the majority of our budget is spent on staffing, and we know that we don't have sufficient budget for the staffing levels that we have at the moment. So we are going to have to look at doing things differently. That might be through more commissioning of services, or it might be through looking at the configuration of our workforce, so that the grading, the staff grading, etc., might look different. We might have to look at the level of risk we're prepared to take in terms of who delivers services, you know, and at what grading. So it is quite a challenging picture for us. It's hard to plan for significantly for years ahead, because we know we're under significant financial pressure now. We don't expect that to change in the next 3 years. We have a medium-term finance strategy which is built on achieving significant savings over the next 3 years, and to achieve those savings, our workforce will have to change. It's either going to need to reduce in number, or the configuration of that workforce will change. We do use supplementary staffing in the Health and Social Care Partnership. A lot of that comes through people who have substantive contracts with the partnership, but may also have relief or bank contracts, either in the same service and work additional hours, or in other services. So for example, we have home carers who will also have a relief contract for our care homes, and vice versa. So we do supplement our staffing with our own staffing working additional hours, or with relief contracts. We do use agency staff where we're not able to meet the needs of the service, or to deliver that service safely, and that's usually for short-term absences rather than for long-term absences. So longer-term absence is easier to plan for and manage our services around, but for short-term absence, sometimes we do have to rely on agency staff. We've got a significant piece of work that's happening around our care homes at the moment, to look at how we apply a consistent style of rostering across all of our in-house care homes, and looking to try and reduce agency use through that method. We're doing the same around our hospital, hospital services. Obviously, we've got we sometimes have to use agency requests in emergency situations in our community hospitals as well. So it is something we're monitoring very closely as a partnership, looking for areas where we've got you know, if there are outliers in terms of the amount of agency use, in terms of the amount of bank staff use, trying to understand the reasons beneath that, so that we can put in targeted improvement actions around that. So we do use agency workers and bank and relief staff, but monitoring that closely and looking to improve where we can.
Thank you. I see that Councillor Cassie has put his hand up, so he might be on something in relation to this. But to use your words, Shona, and I appreciate your frankness and your honesty, and but the system that we have at the moment, looking at it holistically, I mean, the inability to plan, to use your words, and the hand-to-mouth sort of approach that we have at the moment, that really is unsustainable, isn't it? I mean, that's the reality, because if you're unable to plan, then for the longer term, not least in relation because of the demographic time bomb that we have, that's the fundamental issue, isn't it? Or one of the fundamental issues. I don't want to take up any more time, but it seems to me that that is the absolute crux of the problem that we face at the moment. Is it not really? Thanks.
Yeah, I think it's definitely challenging. And sorry, I don't mean to suggest that there's no planning at all that happens. I mean, we know that we need to reduce our spending by approximately £5 to £6 million in each of the next 3 years. And given that the majority of our budget is spent on paying for staff, and those staff are delivering services to people, it's really hard to to kind of reduce that spend without it having an impact on service delivery. We do have, in terms of workforce planning, we have the Health and Care Staffing Act, which covers the majority of staff who are employed by the Health and Social Care Partnership, not all, and that does place duties upon us in terms of workforce planning and factoring in time to ensure that we've got a workforce that is appropriately trained, developed, skilled to be able to deliver the services, and that they have appropriate, appropriate support at work, management support, etc. So we plan around that. We also have some services which have recognised national level staff planning tools that we have to adhere to as well. So that does place additional pressures in terms of we have duties under staffing legislation that place additional pressures on our budgets as well. So yes, it is challenging doing that on a year by year basis.
Thank you very much.
You're on mute, Chair.
Sorry, just to follow up from Councillor Reynolds, do we distribute our staffing levels in a data-driven basis, so where need is? And also, you mentioned bank. Now, bank is a very expensive form of staffing, so perhaps more focus on retaining staff and using them to, or not using, that's not the phrase I want to use, but utilising their abilities to the best possible outcomes. So, is there any way that we can reduce the bank element of it?
Yeah, and I think that's something that we are definitely working on. So I think there were two parts to your question there around how we make sure that we've got the right staff in the right place at the right time, and I suppose that's done on a a kind of a planned basis, but also on a short-term basis as well. So we do report a couple of times a week around service levels across all of our health and social care services, and we have a sort of tiered escalation system that we use there. So for example, if we have one team in Aberdeenshire that is experiencing either significant staff shortages or significant additional pressure because of increased demand for service that we can't meet, we obviously would first of all look to kind of harmonise staffing within that area, and then we look to do that across Aberdeenshire, with mutual aid, mutual support from other parts of the system. And then if we need to escalate further, we can make an ask of the wider system around particular services. So we do have a method of making sure that we've got the right levels of staffing across the Shire as much as we possibly can on a day-to-day basis, and on a planned basis using those kind of recognised staffing level tools as well. So that's how we manage that. In terms of bank staff, I think the bank and relief staff, so it's bank staff in the NHS services and relief staff in our council services, that is expensive in that, you know, if you're covering for sickness absence, for example, it's an additional cost on top of paying for the staff member who's off sick. We try to manage that through having some leeway in our rostering as much as we possibly can, but isn't avoidable overall. So we do have a focus in our workforce plan around managing things like sickness absence robustly, and making sure that people have support to remain in work, or to return to work as soon as they possibly can. So we are focusing on that. We also have a workforce monitoring and assurance group, and we've done a deep dive into the use of supplementary staffing, so the use of bank relief and agency staffing, as well, as I say, to look for areas where that use is higher than we would expect, or is significantly higher than other parts of Aberdeenshire, so that we can kind of target improvement activity around those services as well, and support from our HR colleagues to do that too.
Thank you. Councillor Menard.
Yeah, well, thank you, Doreen. You've asked a lot of the questions I was going to ask there regarding staff. I mean, how big is your staff turnover? How effective are you at retaining staff? Because I've been hearing stories that, you know, you're not keeping the people that you want to keep for as long as you need to. You seem to have quite a staff turnover at the moment, from what I'm picking up from various people that I've spoken to over the past few months. And it's deeply concerning that you're not seeming to be able to retain people. Is it because of the culture within the business that you're running, or is it whatever? Is it just work pressure for the individuals? And one other thing, it's the vaccination centre. There was issues regarding traffic management and everything else, and I don't see anything about that being resolved. So I'll leave that with you. Thank you.
Thank you, Councillor Menard.
Yeah.
So just to say around the staff turnover and retention, I'm not aware that the data would suggest that we have a specific problem in Aberdeenshire around staff turnover and retention, but I'm happy to go back and look at that. I mean, my understanding, certainly in relation to our NHS Grampian staff, is that we compare with NHS Grampian staff as a whole in terms of retention. But of course, there may be differences locally that the data in Aberdeenshire level masks. So really happy to go back and have a look at that to see if there are any particular issues in any of our services specifically, or any particular areas of Aberdeenshire. So happy to take a look at that. In regards to the vaccination centre, I think there were some potential concerns around traffic that were raised as part of the discussion at the Integration Joint Board when they made the decision around supporting the move of the vaccination centre from Macduff to Banff, and I think there was agreement that officers would work with officers from the council locally to monitor and manage that, and also to look at that in relation to appointment scheduling and that kind of thing too. So I think the vaccination centre hasn't moved yet. I think it will be moving in September ahead of the winter vaccination programme. So something we'll work with colleagues to monitor.
Thank you very much. Like I say, I certainly hope that that issue particularly can be resolved, because traffic management is key to making a success of that. But thank you.
Thank you.
Thank you. Councillor Bell.
Thank you, Chair. And like Councillor Cassie, I better declare a transparency that I am a non-exec on NHS Grampian Board, just for transparency reason. Thank you, Shona and Fiona. Building on Councillor Reynolds' rurality, highlighting that, could you maybe expand a bit on how our community hospital review is coming on, and what stage we're at with it? Thank you so much.
Yeah, so I think they've completed the first stage of the review, which was really around gathering data and information around the current use of the community hospitals, because we know they're used quite, or they operate quite differently or provide different services across Aberdeenshire, and they've now moved on to the second phase of that project. So they are yeah. So they've completed that sort of planning and investigation stage, focusing on the activity, challenges and strengths in the estate across Aberdeenshire community hospitals. I think there is some interdependency as well with the work streams under the Home First and Discharge Without Delay work. There is an element of that work that is around community hospital and step down inpatient rehabilitation services. So I think those two have now become quite closely linked. So I think they are just working on things around both of those projects.
Thank you. Just to see, because it'd be interesting for us to find out more information about the data at a later time, just to see how that data was gathered and what it's showing. Okay.
Okay. Thank you. We can look to bring a more detailed report back on that, Councillor Bell.
I think that would be interesting for us, especially with our community hospitals in Banff and Fraser. Thank you.
Thank you. And Councillor Cassie again.
Yeah, thanks for allowing me back in, Chair. Just one brief point following on from the workforce discussion that has taken place in quite some detail. Shani, you've highlighted that there's got to be some financial savings within the partnership, etc. We know about the demographics that are going in the wrong way for those savings to be made, because we're going to need more and more and more in the way of service provision. And you talked about the decommissioning or the commissioning that's going on with other providers to provide those services, yet we're fishing in the same pond for staff as they are fishing in the same pond for us. How far away from not being able to fulfill our statutory obligations are we? We are going to be having less staff, but more to do. And what effect is that going to have on the workforce that will, or has there been any work looking into what effect it will have on the workforce in the very near future? Because by 2030, which is not that far away, there's going to be heaps of folk crashing through the 80 barrier, which brings with it itself its complex needs, because more complex needs are being produced now. So how far away from not being able to fulfill our statutory obligations are we? I know you're going to say it's not going to happen, but some reassurance would go some way.
Yeah, so I think when we have looked, for opportunities to save money and where we could potentially do things differently, the first thing we consider is whether it's a service that we have a statutory duty to provide ourselves, or to provide at all, and then we may make a recommendation around a service because it isn't something that we have a statutory responsibility to provide. So I guess that's where we've looked for savings up to now. Is it something that the partnership should be providing or commissioning at all? And if not, we may look to do that differently or stop that service. If it is something that we have a statutory duty to provide, is it something that we have to provide ourselves, or is it something that we can legitimately commission? And can we achieve the same outcome more efficiently by commissioning the service rather than providing it ourselves? And that's very much been the focus around our care at home service, for example, and looking at how we change the way that we deliver that. What we are trying to do is get a balance between providing those services to people who really need them now, and work ourselves in a way that supports people's recovery, supports rehabilitation, supports people to maintain their independence for as long as they possibly can. So we've got these two strands of our work that is about trying to meet that need now, and potentially reduce demand in the future, because we know we've got an aging population. We know we've got a big gap between healthy life expectancy and actual life expectancy. So people living a lot of years in poorer health with a need for higher levels of support. So a large part of our focus is on how can we support those people as they age to age in better health. And that's not something that we do on our own. It's something that we do very much working with our partners in local communities as well. So sorry, I'm answering your question in a very roundabout way to say I don't think I could put a figure on it and say, oh, you know, within a year we won't be able to meet our statutory obligations. Obviously, it's the first thing we consider when we're planning for services is focusing and prioritising on those services that we have a statutory duty to provide, and ensuring that we can provide those safely and effectively.
Yeah, I know it's very much a movable feast, but it's going to be not too long before we've got rid of all the stuff we don't have to do, and you still have to make cuts. That's when the problem's going to come. And the way things are going, that's not too far away with the amount of money that just keeps increasing with inflation that has to be saved.
Yes, yeah. And I think we have to take a proportionate and risk-based approach. And I think that's something, you know, a consideration for the Integration Joint Board in terms of what is our appetite and our tolerance for risk in terms of how we deliver services. And yeah, that might have to change depending on you know, that continued pressure on the partnership's finances.
Okay, thank you.
Thank you, and thank you, Sharon. I think that's when we have to go back to governments and say we need more money if you wish us to do our jobs properly. I don't see any more indications. So I note that this is going back to the IJB and we have to provide feedback. Emma, can I ask if you have captured the feedback from the points raised by the members today?
Yes, I have, Chair. Thank you.
Thank you. Okay, members, under page 47, we are being asked to note the contents of appendices 1A to 1C and appendix 2, provide feedback on local health and social care services delivery issues for onward reporting to the IJB. Committee, do you agree the recommendations? Can you verbally agree them, please?
Agreed.
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 Thank you, Shona and Ryan, and we've somebody else here today, and I can't think who it is. Fiona. Sorry, Fiona, for coming along today and for answering our questions. Committee, I think we will now take a short recess. I think it's 11:02. I think if we come back at 11:15, for the next paper. And committee, I'd ask you to make sure that your cameras are off and your microphones are muted. And if Heather and Emma could pause the recording and the live streaming, please.
The live stream's